Watch this video till the end to know all the important dermatopathological terms used routinely. Hello dear students, myself Dr. Maddineni Srinivas. Welcome to Crack Derma DrMSD. So the first term which we are going to cover is called as acantholysis. Whenever you hear this term acantha, remember we are trying to explain something in relation to stratum spinosum. So lysis means loss of the intercellular connections in between the keratinocytes. Remember students, keratinocytes are the principal cells which are present only in the epidermis. So acantholysis is seen in disorders which are having problem in the epidermis, and ultimately there will be separation of the keratinocytes, and because of this separation what will happen, the keratinocytes which will be usually having a shape, they are going to become rounded and they are going to have three important changes. The nucleus which is going to be present in the center will be appearing hyperchromatic, there will be a perinuclear halo and the cells are becoming round. These are what are called as acantholytic cells. These are also called as Zang cells. Why? Because they are seen with the help of the Zang smear with Romanowski stains, that is Giemsa stain. And very classically this is seen, acantholysis is seen in the intraepidermal autoimmune blistering disorders, especially the pemphigus group, pemphigus vulgaris. It can also be seen in the bacterial infections, bullous impetigo and also staphylococcal scarlet skin syndrome. It is also seen in viral infection, herpes simplex viral infection, varicella zoster viral infection. Genetic disorders, remember Hailey disease and Darius disease also can have this acantholysis. Very important term from dermatology point of view. Next is acanthosis. Remember stratum spinosum, if it is thickened then we call it as acanthosis. Stratum spinosum is also called as prickle cell layer and it is commonly seen in psoriasis and also lichen planus. And if you remember, in the chronic eczema the patients are going to have a constant scratching, because of which skin is going to show three important changes: thickening of the skin, increased pigmentation, increased skin markings, all of them put together we call it as lichenification. So yes, in the chronic eczema also we can see this acanthosis, which is the thickening of the stratum spinosum layer. Next term is very important, colloid body, civate body. It is also called as cytoid body. Remember, in lichen planus, we are going to see band-like lymphocytic infiltration at the dermoepidermal junction. These are going to cause damage, destruction of the stratum basal layer, because of which the sawtoothing of the retroridges will be seen. And these lymphocytes, if they reach the epidermis, they can also produce the apoptosis of the keratinocytes, because of which they are going to become eosinophilic hyaline ovoid bodies, which will be present in the lower epidermis and also in the dermis. These are what are called as cytoid bodies, colloid bodies or civate bodies. Very classical histopathological picture of lichen planus. You need to remember. And also there is one more term which is bonus, which is max Joseph space in lichen planus. Because of the constant damage of the lymphocytes of the stratum basal layer, there will be empty spaces produced. These are what are called as max Joseph spaces. Right. Next terms, core grains, core ronds are related to a disorder which is a vesiculobullous disorder called as Terrier's disease. Remember, in this the keratinocytes are going to show abnormal premature keratinization, which is called as the Dyskeratosis. And in Terrier's disease, this Dyskeratosis can be seen. Apart from this, there are other disorders, like for example in the malignancies, remember squamous cell carcinoma. In the pre-malignant disorders, the Bowen's disease, which is the squamous cell carcinoma in situ, and also actinic keratosis and Darius disease. In all these disorders we can see this Dyskeratosis, and in specifically Darius disease we are going to call these dyskeratotic keratinocytes, which are present in the superficial layers as the core grains, as you can see here in the green arrow, which is depicting these rice grain like horizontally oriented grains like structures, which are called as core grains, dyskeratotic keratinocytes. Basically these are. And if the same dyskeratotic keratinocytes are having a round shape, as you can see here, the yellow arrow which is pointing towards them, which are present in the spinous layer and granular layer, again in the Darius disease we call them as core ronds, because they are round in shape. Okay. So core ronds, core grains seen in Darius disease. Remember, Darius disease is also called as keratosis follicularis. Right. Next epidermotropism. The name is self-explanatory. Epidermotropism. Tropism is affinity, liking, attraction. So in the mycosis fungoides, which is also called as cutaneous T-cell lymphoma, it was observed that there will be atypical T lymphocytes in this condition which are present in the dermis, and they have affinity to reach the epidermis. Dermis to epidermis, they will reach, and this collection of the atypical T lymphocytes in the epidermis is what is called as epidermotropism. Very important term, you need to remember. And like the lymphocytes reaching the epidermis, because they like the epidermis, if you are liking this video, please do that like button. Don't leave this video without giving a like to this video. Next term is Grenz zone. Remember, in the lepromatous leprosy, according to the Ridley-Choplin classification, on the TT side, we are going to have the proper granulomas, epithelial granulomas. But in the lepromatous leprosy, we are going to see the presence of the foamy macrophages and also the M. leprae bacilli in the dermis. And it was observed that in between the epidermis and the dermis, there is a cell-free zone which is described as, which is called as Grenz zone. Grenz zone. So you are able to see this is the Grenz zone which is present in between the epidermis and the dermis, which is affected below. Very classical of lepromatous leprosy. Next term is hypergranulosis. Remember, in the lichen planus, which is a papilloscomas disorder, there is a wedge-shaped hypergranulosis, that is thickening of the stratum granulosum layer of the epidermis. This is what is called as hypergranulosis. Next term is hyperkeratosis, self-explanatory. Hyperkeratosis, thickening of the stratum corneum, which is the outermost dead layer of the epidermis, is what is called as hyperkeratosis. And this can be seen in various conditions, like for example, chronic eczema, lichen planus, and also psoriasis. So here you are able to see this is the hyperkeratotic epidermis. Next is the collection of the neutrophils which is present in the stratum corneum. It is called as Munro's microabscess, very classically seen in the psoriatic histopathological picture. So these are the collection of the neutrophils in the stratum corneum, Munro's microabscess. Next term is orthokeratosis. Remember, dear students, if there is thickening of the stratum corneum without any parakeratosis, that is what is called as orthokeratosis. Many students have a doubt about this condition, which is the hyperkeratosis without parakeratosis, simply put, and it is also seen classically in the lichen planus. Next is papillary tip microabscess. Remember, in dermatitis herpetiformis, which is a subepidermal vesiculobullous disorder, there is going to be presence of neutrophilic infiltration collection in the dermal papilla, which is described as papillary tip microabscess. Very, very important. And if you do a direct immunofluorescence, what are we going to see in dermatitis herpetiformis? We are going to see the deposition of the IgA in a granular fashion in the dermal papilla and also in the dermoepidermal junction. Very important clinical finding or dermatopathological finding, which you are going to see in biopsy and also in the direct immunofluorescence. Next is parakeratosis. What is parakeratosis? It is a persistence or the presence of the nucleus in the stratum corneum. Stratum corneum is a dead layer, but if there is a nucleus persisting, retaining presence of the nucleus in the stratum corneum, we use this term, special term called parakeratosis. And this is classically seen in the psoriasis. It can also be seen in actinic keratosis and Bowen's disease. Here in this picture, you can clearly see these arrows which are pointing towards a nucleus which is retained, persisting in the stratum corneum. So next is a Pautrier's microabscess. We have already discussed this in the epidermotropism. So mycosis fungoides, cutaneous T-cell lymphoma, they are going to be malignant atypical lymphocytes present in the epidermis, and this collection we call it as Pautrier's microabscess. As you can see here, this is the Pautrier's microabscess. And one more important point to remember is this MP. So M is there in P and P is there in M. What does this mean? What do you want to say? So M is Munro's microabscess are seen in the patients of the psoriasis. Pautrier's microabscess are seen in the patients of mycosis fungoides. So M for P and P for M. I hope you have understood this simple trick to remember the microabscess, which condition, which microabscess is seen. Next is spongiform pustules of Kogoj. Again, this is a feature of the psoriasis in which there is going to be collection of the neutrophils in the stratum spinosum. This is again very classical finding, as you can see here, collection of the neutrophils in the patients of psoriasis in the stratum spinosum. Next is spongiosis. What is spongiosis? It is the intercellular edema. In between the cells, there is going to be collection of the fluid in the epidermis, which is going to cause the widening of the spaces between the keratinocytes, and it is a feature very classically seen in eczema, especially it is acute eczema, where clinically we are going to see all the changes of the dermatitis, inflammatory changes, that is there will be oozing, there will be vesicles, and if you do a histopathology in the biopsy, what are we going to see? Obviously the same changes are going to be reflected in the biopsy. As you can see here, these are the cells, these are the keratinocytes, and what are these white spaces? What are these white spaces? They are all the edematous fluid which is collected, which is not staining, because of which it is appearing white in color. So these are all the important dermatopathological terms which you need to know very routinely, which are used and also important from exam point of view. I hope it is clear and you have understood all these terms. If so, please do hit that like button. Also do subscribe for more such awesome videos on a regular basis. Thank you so much. Comment thank you if this video was really helpful. Happy learning. Sarvam Sri Krishna from Sarvejana Sukhna Bhavantu. Bye bye.